Hello, my name is Erinn Harris, MD. I am a physician located in Tyrone, Georgia with Harris Internal Medicine. Tyrone, Georgia is a suburb that's south of Atlanta, and I am your DPC doctor on the YouTube video channel. I'm coming to you again this month explaining more about direct primary care. If you guys have not heard about direct primary care, or if you're new and trying to understand more about direct primary care is a way, a new innovative model, is a way to contract with your patient to provide medical coverage or primary care coverage. So it's not a health insurance plan, it's basically like a membership, like say if you think about a gym membership. So instead of contracting with insurance to cover any office visit fees, we actually contract with the patient, which is the way basically we used to do it in the past. So your office visit fees are covered by a monthly membership. Your membership fees usually average, on national average, is about $80 a month. My office visit fees actually range from about $55 a month to about $95 a month, and that's based on age. Usually, for the most part, I know with me, for the most part, that covers everything in the office. No co-pays, unlimited office visits during that time. It also covers any office visit procedures, any office visit, any in-office labs, and of course the office visits, if I didn't say so before, the office visits are usually extended. My office visits are about 30 minutes. So it's just a really great way for us to practice medicines, for patients to enjoy coming to, not enjoy coming to the doctor, but don't have the hassle of co-pays and not worrying about what's being covered, what's not being covered. Would you get a bill in the mail? So it really does take care of all that. Once you pay your monthly membership, basically everything in your primary care doctor's office is taken care of. So, I get a lot of questions from patients. I get a lot of questions from other people who are interested in direct primary care, because the one big thing that they want to ask me about is, how does it work with insurance? And if I go to the hospital, if I have a surgery, if I need, high cost medications, how does that work? So there are two main ways, I think the most effective ways that work with direct primary care. The one way is if you have a high deductible health insurance plan. With a high deductible health insurance plan, usually your premiums are much lower. Now we're seeing the premiums increasing, so the deductibles are actually also increasing. I know the national average for high deductible insurance, the national average of the deductible for a high deductible insurance plan is about $5,000, correctly. So, we are really spending a lot of money on healthcare. So, with lower premiums with a higher deductible healthcare plan, you're still paying less out of pocket. However, with a high deductible health plan, you have to meet that deductible of $5,000 paying out of pocket before any any coverage would be covered by insurance. So anything that you would need to be covered by insurance, except for preventative things such as, would you say, a mammogram or colonoscopy, that will be covered. But however, anything other than preventative care will not be covered until you meet that deductible. So the way that direct primary care works with a high deductible health insurance plan is that you're paying less out of pocket. So with you paying about $600 to $900, $1,000 a year, it's much less than meeting that $5,000 a year. Now you can also submit a claim to your health insurance company to see if our membership prices will be covered, or any costs will be covered with your health insurance plan. Usually, all of us, of course, are out of network because we don't contract with insurance companies, so we're considered out of network for insurance. So that's one way to use a high deductible health insurance plan. The other way is something that's we've seen over at least 20 years is with health share, with healthcare cost sharing ministries, or a health share ministry or a health share organization. These have usually been established within the Christian community. So Christians have put, as you say, their money into a pot, or had their share, the monthly share, put into kind of like a pot, and whatever you need, anything covered for as far as surgery or medications or a visit to your doctor, that is taken out of that and used as you need it. So anyone else who needs it, it's kind of like sharing healthcare costs. So the one new kind of innovative thing that's been coming, that's new recently, is actually Liberty Health Share has created Liberty Direct, which actually provides kind of like a network of direct primary care doctors, and they pay a stipend towards your monthly membership. And so that's something to kind of look into. So the one great thing about all health share ministries, or for most health share ministries, is that it is exempt from the it's exempt from that ACA requirement, or you're not being, should I say, if you don't have insurance, so you're not going to have to pay the penalty for. So you kind of cover from that ACA penalty of not having insurance, because you do, in a sense, have healthcare coverage. So they've kind of, if you're part of a health share ministry, you're not going to be penalized for not having insurance, which is great. So anyone who's actually thinking of saving money, that a health share would be a really good idea to save money with healthcare costs, because it usually costs less than even the high deductible health insurance premiums that we're seeing now. So again, those are the two ways that I found since I've been practicing medicine that really works well with direct primary care. Of course, you can Google health share ministries if you want to know more about them. And if you want to know more about my practice is, again, Harris Internal Medicine is located in Taiwan, Georgia, south of Atlanta. So anyone in the South Atlanta area, or the Southwest Atlanta, suburban area, South Atlanta area, I'm in that area. So Peachtree City, Sonoya, that's where The Walking Dead is actually filmed, if you have any Walking Dead fans out there. Fayetteville area, Fairburn. And you can also look on my website. You can look on my website, which is www.harrisinternalmed.com. Again, www.harrisinternalmed.com. All right, you guys. I look forward to seeing you again, or talking to you again next month. And you guys have a great month. See you again next time.